Hola a todos y muy buenas tardes. Gracias por conectarse a esta sesión informativa de la OPS sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel, del Departamento de Comunicación de la OPS, y esta sesión durará entre 45 minutos y una hora y tomaremos preguntas hasta ese momento. Ya hemos recibido preguntas de ustedes por correo electrónico y también podrán hacer preguntas a través del chat con el botón Q y A. También estaremos tomando preguntas en vivo y para eso les pedimos que antes nos escriban por el Q y A para coordinar y siempre recuerden incluir su nombre y el medio de comunicación al que representan. Les recuerdo también que contamos con interpretación simultánea en inglés y en español, a la que pueden optar a través del botón Interpretation. Hoy nuestra directora, la doctora Carissa Etienne, les informará sobre la situación epidemiológica actual de la COVID-19 en la región y brindará recomendaciones sobre lo que podemos hacer para minimizar la transmisión durante las reaperturas. Acompañan a la doctora Etienne en esta sesión el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director del Departamento de Emergencias en Salud de la OPS, y el doctor Marcos Espinal, director del Departamento de Enfermedades Transmisibles de la OPS. Ahora sí, entonces quisiera invitar a la doctora Etienne a dar sus palabras de apertura. Doctora Etienne.
Thank you, Sebastian. Good afternoon, and thank you for joining today's press briefing. This past week, the Americas reached two somber milestones. Over 500,000 deaths and nearly 15 million cases have been reported in our region. While COVID-19 has eased its grip on some of our region's hotspots, for example, as in the United States of America, where we have been observing reduced numbers of weekly reported cases, even though these national figures mask the fact that there are still areas within the USA which are reporting concerning daily increases of COVID-19 cases. The situation within different countries is more complicated. In South America, areas of Colombia along the Venezuelan border have seen cases increase more than tenfold over the last 2 weeks. We see similar patterns emerging in areas of Argentina. Within the Caribbean, many large islands like Jamaica, the Bahamas, and the Dominican Republic are also witnessing drastic spikes in cases in some of their localities. Death rates are also climbing in some areas of Mexico. And we're seeing similar trends in areas of Ecuador, Costa Rica, and Bolivia, where deaths from COVID-19 continue to mount. This is a stark reminder that countless people in our region remain vulnerable to infection, especially large populations that have not yet been exposed. Although the entire world is racing to develop new tools to prevent and cure COVID-19, a safe and effective vaccine that can be manufactured and delivered at scale is not around the corner. And yet, our region has started to resume near normal social and public life at a time when COVID-19 still requires major control interventions. The reasons for doing so are understandable. Children need to learn, families need money to eat and live, and global commerce cannot be restricted forever. But we must be clear that opening up too early gives this virus more room to spread and puts our populations at greater risk. Look no further than Europe, where several countries that previously flattened their curves are now seeing a resurgence of. We should reverse course. Indeed, the social and economic realities facing countries are more pressing than ever. It does mean, however, that we must approach daily life in a new way that reduces risk and places health at the very center of every decision that we make and policy that we implement. Whether it's restarting schools, reopening public markets, or resuming international travel, when and how we do it matters. First, we must keep a safe distance from others. These measures are proven to limit the spread of COVID-19 and must become like second nature. Rather than seeing them as a matter of personal protection or even courtesy, they should be regarded as a civic responsibility of the individual. Let's look at some environmental measures. Public spaces must also be adapted to reduce transmission. Simple yet important measures like offering hand washing or hand sanitizing stations and altering layouts and hours to allow social distancing and to limit the number of people in the same space at the same time should be the norm for now. Indoors, we need to ensure adequate ventilation and limit close contact with each other. We also must continue to keep our distance outdoors. National and local authorities have a duty to provide clear evidence-based guidance and to ensure that individuals and businesses adhere to it. We saw this leadership early on when many countries implemented lockdowns and restricted gatherings. I dare say that we need the same level of commitment as these measures are lifted so that everyone has the information and the tools that they need to protect themselves and others. These principles of adjusting individual behavior, adapting spaces, and exercising political leadership are key to making transportation, workplaces, schools, and public spaces as safe as they can be for all. PAHO and WHO have developed extensive guidance for countries on how to minimize the risk of transmission in these settings. Today, I want to talk a little more detail about two important activities that many in our region are grappling with: travel and restrictions. Let's talk about international travel. When people travel between countries, so does the virus. We are seeing this in the Caribbean, where several countries that had virtually no cases experienced spikes as tourism resumed. This does not come as a surprise, but offers us an important lesson. We are seeing many places within and outside of our region apply travel measures that have limited impact. I want to emphasize that relying on lab tests for travelers is expensive. It is hard to implement, and it is of limited impact in controlling the international spread of the virus. We need to ensure that individuals who are sick or suspect they're sick with COVID and their contacts be quickly identified and isolated to minimize the chances of getting others infected, first and foremost, prior to departure, as well as after arrival. And all countries should collectively work to limit travel for those who have active symptoms or who have been recently exposed. Another issue of elections. Some countries in our region, like Bolivia, Brazil, Chile, and the US, are gearing up for elections and preparing to help citizens exercise their right to vote without sacrificing their right to health. And that's why careful planning is needed to ensure the protocols are responsive to preventing the spread of the virus. Some countries have shifted their election dates to avoid gatherings during periods of intense transmission. Others are supplementing traditional voting methods with mail voting and digital technologies. Governments must lead in national efforts to ensure public health measures are in place for in-person voting and that citizens are aware of how to maintain their safety and that of others at the ballot box. Voting is critical to the social fabric of our region. So the Organization of American States, with PAHO's support, has issued detailed guidance to help governments minimize the risk of transmission, as the health of our citizens must always remain front and center. As leaders across the world face pressure to resume social and public life, it is important that they avoid making decisions in a vacuum. Data about the virus's spread and the state of health systems and services must guide each country's plans to reopen, including the mix of preventive measures that should remain in place to keep people safe. Remember, there is no one-size-fits-all approach. Countries must ensure that they have the staff, the tools, and resources in place to monitor and contain the virus. They must be prepared to carry out tests, conduct contact tracing, isolate and quarantine, and ensure that there is enough hospital beds to care for patients who develop severe symptoms. Make no mistake, let's not fool ourselves. If our health systems are not prepared, it is not the time to reopen. Doing so would risk a handful of cases in one area becoming a full-blown outbreak. The success of our economies and the state of our societies depend on the health and safety of our people. A truth that I urge countries to embrace as they make the decision to resume public life. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We can now turn to the questions that we received over email, and then I will turn to the questions in the chat. Remember that you can use the Q&A button also to submit your questions, and please give your name and the media. First, we have a question from Francisco Javier Moreri. He is the editor of Cover News in Argentina. He says, do you have any hopeful message for Latin American societies to convince them to support the lockdown and or abide by distancing measures? That is something that it seems governments have not managed to impose. Dr. Etienne?
Our region acted early to slow the spread of COVID-19. And we saw many countries implementing public health control measures by middle of March. Let's be clear, this had a remarkable impact throughout the Americas and saved countless lives. So these early measures helped us to buy time to prepare our health systems. They also allowed us to ramp up our testing capacity and to develop a greater understanding of the virus and how best to prevent it. Our countries did well generally. But it's been 6 months and many of us are growing tired and our economies are strained. Still, we have no better option than to learn from the past few months and to let science guide our actions. We know that the package of interventions that most countries are implementing, we know it works, including social distancing, the use of masks in public spaces, and limited large gatherings. We also know that these measures can be targeted. Places with a higher risk of transmission need more restrictive measures than areas that may have brought the infection under control. We need to apply these measures locally and at the right time. Good surveillance and up-to-date information about hospital capacity should guide this decision. As I said just now, every one of us has a role to play in protecting ourselves and to protect those around us. But governments must support their populations with the information and the resources that they need to maintain preventive measures. I mean, let's face it, our region has been through many health challenges before, including many outbreaks and past pandemics. And we have used the lessons learned to build stronger health systems. Just in the past 11 years, we were able to handle the H1N1 pandemic and the Zika crisis in several Latin American countries. We were able to bring these threats under control. And as I am sure that we will eventually overcome the pandemic. Let's hold on to what we know works. Over.
Gracias, doctora Etienne. Melina Ochoa.
Thank you, Dr. Etienne. Melina Ochoa from Uno TV in Mexico City sends us an email and now a chat message saying, clinical tests phase 3 of AstraZeneca vaccine have been renewed after being paused because of effects on the patient. What would PAHO say about the vaccine? Dr. Barbosa, this is one of the 9 vaccines that is in stage 3 of clinical testing, and that is the final phase. Phase 3 is the most complex one because it has to involve something like 30,000 volunteers or more, and that takes time so as to get the results. Now, that procedure of having put on pause that trial, that means that there was a person that had received the vaccine. The person has some health condition. So that is just standard procedure. That is always done. There is an independent committee that does the analysis. And after the analysis is reviewed, it was found that the health problem presented by the person vaccinated had no connection to the vaccine. And consequently, the trial was restarted. That can happen with any trial. It is merely proof that this is being taken very seriously and that clinical trials have that responsibility to assure that the vaccine will be safe and efficacious. Thank you. Thank you, Doctor. The next question is from Alberto Oliveira from Asahi Shimbun. This is a Japanese newspaper. And the question is, the pandemic in India, is it going to produce a shortage of health inputs? Because we know that India is a common vendor to the countries of the region. Dr. Ugarte, please. This is a very important question because the Americas were severely affected when there was an important spike in the number of cases early in the pandemic. And the world market of testing, of inputs was blocked. So PAHO made a decision. Even before the pandemic, we have PPE in our humanitarian stockpile. And thanks to that, we had supplies early on. However, despite the block on trade, the limited supply, it was hard to get more personal protection gear. But the global production system has increased significantly. Through the global supply system that was led by WHO, PAHO was able to participate directly in 2 ways. First of all, to ask for PPE as a donation as part of both PAHO and WHO systems, but also for direct purchase, direct procurement on the part of the countries. So I can tell you what we did. Something like 17 million tests, molecular tests, were sent to the countries. 1/2 of them were a grant, a donation from PAHO. And 150 tons of PPE were sent out. That means millions of PPE PPE items to staff in the countries. But even so, right now we see that the testing supply is diminishing. Because of that shortfall, the detection of cases, lab diagnosis has been held back. It's not quite as quick, even though countries had decentralized their systems. So there is a second effort to buy this equipment, and we are buying kits to test for antigen. And here there is a possibility of purchasing a larger amount. Today, in a global meeting of the Security Council of WHO, that matter was discussed. And it was said that the Americas are going to be receiving the equipment required, and that countries will have access to that purchase. Now, timing is always something that's hard to define, in part because of the restriction on flights and also because of logistics. Sometimes it is hard to get these supplies to the countries, so that may delay the effort. But basically, that is the answer. The idea is to have a quick response. The impact on the Americas is less now than it was early in the pandemic, and India has a testing and input production measures that once again are coming online, and now we have PPE in the humanitarian stores in the region so that we can distribute those goods to the countries that need them. Thank you, Doctor. Now we hear from Jacqueline Morbel from Ahora Mismo in the Dominican Republic. The question is, how long does immunity last if a person has already had COVID-19? Dr. Espinal? Yes, and thank you very much, Jacqueline. That is a very important question. We don't yet know how long immunity lasts after being infected with COVID-19. We have to realize that we haven't had this virus around for a whole calendar year. So regarding immunity, there are many questions that still have no answers. But what we do see, and we have evidence for this, is that 3 to 4 months after, antibodies to the virus have been detected in the blood of people that have been affected. Now, antibodies are protein substances produced by blood cells in reaction to a virus, a bacterium, in a foreign body. And that means that that person had a contact with the virus, but it doesn't mean that the immunity is going to last 4 months. Antibodies have been detected, but there is the thought that immunity can last longer. With SARS, we know immunity can last 2 years. So more research is needed to be able to respond to these questions. We don't know if immunity can be affected by age. For example, are people very young, very old? We don't know if immunity can be affected according to the virulence or the severity of the virus. So a lot is going to depend on all of that. Now, there are some hypotheses that suggest that a person who has been infected and then may be reinfected, that's a case that was studied several weeks ago. Perhaps the virus may not affect that person as much because there is some protection from the antibodies. But immunologically or from the public health standpoint, that is not the most important thing. The most important thing is the cases we have, because we have not documented cases that have been reported. That is not the majority of cases. The most important thing is measures so as to avoid continuing the spread, avoid contagion to other people. We have not had enough time really to see how long immunity actually does last. Thank you, Doctor. And now I would like to give the floor to Blanca Barades from Milenio in Mexico. So Blanca, if you can hear me, Please turn on your microphone. Good afternoon, everyone. My question has to do with the excess mortality. In Mexico City, 20,000 death certificates were found saying that people had died from COVID, but that wasn't part of the official statistics. So that is a question. What do you think this excess mortality can be in terms of reporting? And then a second question, has Mexico signed the agreement letter to buy vaccine? I think that the 18th is the deadline. So what is that down payment required so that we can be sure that the vaccine will reach countries with fewer resources? Dr. Barbosa, please. Yes, I'd be glad to take both questions. The first having to do with excess mortality. PAHO, we are supporting the countries of the region so that they can make that estimate, so they can estimate the excess mortality that occurred during the time of transmission of COVID-19, not only in Mexico, but in all countries of the region. They are already engaged in making that estimate. Here we have to say that this excess mortality came not only from Latin America, but in the United States and Europe, in all countries. We have seen that during the peak of the transmission, the speed, the number of deaths often really overwhelmed the ability that countries have to register this information, even countries with good information systems, which is the case of Mexico. So it's important to better define what actually happened in the pandemic. Now, to summarize the technique, you make some adjustments and you compare the mortality that is expected for a given period with the mortality that was actually observed. So that happened in all countries. And it's important that Mexico do this, that they identify this broken down by province, state, even city. Now, regarding your second question, in the region, there was an important decision made regarding COVAX. All the countries in the region, with the exception of the United States, sent in letters of intention. And now they have until the 18th of this month to sign this commitment. Some countries are suggesting that that deadline be extended. It is a very innovative document, and PAHO supported Gavi having the document, the letter of commitment translated into Spanish. So there are still 3 days left before that deadline. Now, COVAX is not requiring more than the country should just to support other countries. COVAX is coming up with donor resources so that poor countries, small countries in the world can receive vaccine without paying. So 10 of those countries that will receive vaccine are in Mexico. Other countries like Brazil, Mexico, Argentina will be paying for the vaccine. And the proposal that we are presenting is that they pay an affordable price. In other words, that the vaccine will be affordable for all middle income countries. Thank you. Thank you, Doctor. The next question comes from Mariana de Barros. She is a reporter with TVV in Venezuela, and she says, what would PAHO say of the situation in Venezuela that has limited capacity to do PCR testing, even though the curve of contagion is going up? And that is what the physicians say. Dr. Ugarte, please.
La situación es
Thank you
compleja.
very much for that question. This is a very complex situation. As we know, the health systems and all of the mechanisms to address emergencies in Venezuela have been impacted by the situation that the country has been going through for several years. To that end, the purchase of supplies for tests and also personal protection has been limited, but because of the agreement signed in early June, some of the resources were used for the additional purchase of tests and equipment. All of them are being channeled, and for example, we are going to receive, or Venezuela will be receiving, about 170,000 antigen tests over the next 2 weeks, and this will be increasing the capability for diagnosis. Now, about a month and a half ago, PAHO donated about 20 tons of personal protection equipment. The needs are very significant, and clearly, with the help of all of the partners, the situation may improve. And we also see that there are several actors that would like to support, and I think that the hospitals may also have better capacity to treat patients and also for diagnostic purposes. As to the centralization of testing, that is a challenge. We have been unable to attain the levels that we'd like to have. The efforts are underway, and the Ministry of Health, as well as the members of the National Assembly are and partners of that assembly are working to include from 40 an increase from 4,500 to 6,000 tests over the next couple of weeks. We are working on this, and let's hope that the measures, the public health measures, and also transmission containment can be effective as the hospitals increase their capacity and we are able to centralize tests. Thank you very much. Thank you, Doctor. The next question is from Andrea Saunders from Jamaica Observer, and it reads,
in the region, and has the science indicated that there are more than one strains of the virus? Doctor Espinal, ¿podría tomar esta pregunta?
Hey, thank you very much for your question. I think I alluded to the question in my previous answer. There's one case that has been confirmed reinfected in Asia, and there are others under investigation, but this is not the most important theme at the moment. The bulk of the pandemic is new cases coming still in great numbers. There are some hypotheses there that reinfection could be even mild, but there is also, as you rightly pointed out, the virus can change, and that was the case of the Asian case. So the possibility of reinfection is there. We cannot rule out the possibility of changing in the virus and different strains could be also there. I mean, we need to continue the investigations and watch carefully in order to have more information and evidence about the issue of immunity, reinfection, and re-exposure. Remember that one of the issues of the Asian case was that confirmation has to be by several means, because an antibody test positive could be a false positive, and we need to reconfirm this. So it's not something that is straightforward, but in the Asian case, it was indeed confirmed that it was a different, a second infection or a reinfection. In the Americas regions, we don't have yet confirmed cases, and there are some that are under investigation. So, but the most important thing is it's the number of new cases that we are seeing still, which is very high still in the Americas, although some of our countries are slowly flattening the curve, but still an important number in terms of burden of disease. Thank you. Over.
Gracias, doctor. Siguiente pregunta de Anthony Boal de Reuters.
Doctor, the next question is from Anthony Reuters. This similar question to the one answered by Dr.
How many countries in the Americas have joined
Galvez.
the COVAX facility for equitable vaccine fundings and distribution? And he asks if Brazil has joined. Dr. Barbosa.
Thank you, Anthony, for the question. Anthony, every country in the Americas expressed their interest to engage with COVAX facility. Only the US is not engaged. So all the other countries, including Brazil, are engaged in COVAX. And this is important. Even Brazil, that has bilateral agreements with some producers, COVAX is also interesting for countries such as Brazil because it's another option that the country will have to guarantee access to vaccine. So yes, Brazil is engaged in COVAX facility.
Gracias, doctor. Próxima pregunta es de Gabriela Quiroz.
The next question is by Gabriela Quiroz. It comes to us through the chat. She is from El Comercio, Quito, Ecuador. What are the reasons why Ecuador continues to have a high mortality rate due to coronavirus? Dr. Ugarte. Thank you, Gabriela. In many countries, when the intensive care and access to health are limited, but also when the case increase takes place in a short period of time, in particular in areas where access to care services due to logistics, but also because of the burden upon on these systems. Whenever we have those conditions, mortality rate increases. We see similar situations in various countries, and we need to increase access to services to inform the population that those services are available. We need to indicate that in many cases, individuals wait up to the very end to go to health services for two reasons. First, because there is an increase of patients and also there is a high occupancy rate. But there is also the perception that by going to the hospital, the person has an increased risk. Because of that, people wait up to the last minute to have access to health services. So it is extremely important to establish contact with the health services, be it via phone or any other means, to be able to implement the measures to take care of the people who are sick, isolate them, and also implement the isolation measures, quarantine contacts, and establish very quick contact with the healthcare services. Ecuador is one of the countries that has a very advanced primary care system, and all of the population has free access to health. So even then, the burden on these services could be too high if the population waits up to the very end. So this is a recommendation for all of the region, for every single individual that has symptoms compatible with COVID. It is extremely important to establish contact with the health services and follow the recommendation, doing it through, for example, Facebook, YouTube, or any other recommendation that has not been proven, as a matter of fact, increases the risk of death for people affected by COVID-19, in particular those who have underlying conditions that could worsen their diagnosis. Thank you. Thank you. The next question is by Nicholas Prescott.
Victoria, British Columbia, Canada. I am wondering if you are concerned about the rise in new cases in Canada, particularly British Columbia, where we are routinely seeing 50 to 100 new cases per day, just as school reopen and as we approach the fall flu season. I am also wondering, he says, if you could comment on the idea of mandating or requiring people to wear masks in public by a number of local governments, and whether this is an effective way to contain the spread of the virus. Doctor Espinal, ¿podría tomar estas preguntas?
Thank you very much, Nicolas, for that important question. Indeed, we're not worried only about British Columbia. Canada is experiencing another peak. We have seen in the last week or so an increase in cases, similar to what is happening, not to the same extent, but we have seen in other European countries also another wave of new COVID cases. So the meaning of this is that we cannot let our guards down. We need to continue with the measures because this is going to be for a while with us, and the mitigation measures like and non-pharmaceutical mainly like face mask and social distance and making sure that we isolate ourselves if we have been exposed or in contact with cases are in place. So it is not surprising, and we expect to see different wave until we come to the point that hopefully we will have a vaccine that will be implemented, but it's going to take time because a vaccine will not immediately vaccinate 8 billion people around the world. So regarding the use of masks in public places, PAHO supports the decisions of every government, but it's recommended because if you go out of the house and go to the pharmacy, to the supermarket, these are public places. We need to make sure we use the mask, we use social distance, proper distance, and so on. There are some possibilities not to use it if people are jogging or running to ensure they breathe properly, but it is highly recommended that use of masks are in place because it prevents. They are effective. They work. Thank you. Over.
Gracias, doctor. Tenemos varias preguntas en el
Thank you,
chat.
doctor. We have several questions by Natalia Ditela from Reforma, Mexico. One of the questions is, what is your opinion of the quick tests to detect COVID? Are they trustworthy or reliable? Dr. Jarbas, when we're talking about quick tests, that means that they take a short time, and we have various manners, various platforms for the tests that can be considered more or less quicker or less quick. So we follow the PCR test to confirm a case, and that is the best one we have. That PCR test can have a result, can yield a result in 90 minutes. If we compare that to the time that a PCR test took 2 or 3 years ago, I would say that it is quite quick. But we have other tests, and I think that here you're referring to quick antibody tests. They are not recommended for diagnostic purposes. They could be used for trials or serological surveys because the person takes a little bit of time to produce antibodies, and if it is at the beginning of the disease, and if you sample on the first or second day, the result may be negative and it may be a false negative. Therefore, the recommendation is to use the PCR tests, and PAHO is helping countries have access to them. There are some antigen tests that are quicker, and they are being developed. They're very recent, and we are considering their broader application. But in general, the application for the recommendation is to follow what the countries are doing based on the recommendation by PAHO and WHO. The second question is by Tanya Miss Cartwright from Tribune newspaper in Bahamas.
She asked, is PAHO pleased with the way the Bahamas is managing the COVID pandemic? We have 300,000 people in the Bahamas and our COVID count is a little over 3,000. Please advise, with that count, how are we doing as a nation? Doctor Ugarte, ¿podría contestar?
Thank you, Tania. Bahamas has proven that public health strategies can work to reduce transmission and also to put a balance between opening the economy activity. In the first part of this pandemic, from March to June, Bahamas did very well on that. And since July, some of the cases were identified in family islands. And the last, most of the cases now are being reported in the last few weeks in Grand Bahama and New Providence. The number of cases have remained kind of the same in the Grand Bahamas, but progress is slower in the New Providence, where 75% of the population resides. So the challenges is still something that the health authorities are facing. And in particular, in the high rate of infection of healthcare workers and the capacity of the laboratory. So we are following very closely. We are in close coordination with the Ministry of Health and health authorities. And the large number of cases in New Providence and ongoing detection is one source of optimism in terms of the capacity of the health systems to rapidly detect the cases. And I would say that the public health measures must be strictly followed in the country to reduce the transmission, at the same time that nationals are considering the relevance of new cases that is a source of concerning. So in this regards, I would say that the number of cases that we are seeing in the Bahamas and in other countries in the Caribbean that's increased because of the opening of the economy is a source both of concern. We need to know that with these measures must be implemented in the long run, but at the same time, we have to put in balance all the opening the economy and also to open also the access to other essential health services in the countries. Thank you.
Gracias, doctor. La siguiente pregunta es de
Thank you,
Juan.
doctor. The next question is by Juan Manuel Nieves, who is in Argentina for Shishoa. Argentina, according to him, will have been by December 20th, 6 months in quarantine. So the question is, what did Argentina do well and bad? Because in spite of those efforts, Argentina is one of the 10 countries that has the most cases and one of the is among the 15 countries that has had the highest number of deaths worldwide. Thank you very much. This is Dr. Espinal. Argentina was one of the first countries to implement lockdown measures that had an impact. Argentina had a very good response at the very beginning, since they included all of the governors as part of a nationwide discussion. Argentina put their industry to work on the production of masks, respirators, and they did implement measures. But it shouldn't be summed up as what they are doing right or wrong. This is a very unpredictable virus. So we could look at what could be improved, because I think that whatever Argentina implemented was right, but it could be improved. They could improve testing and also contact tracing. Contact tracing in particular in the metropolitan area of Buenos Aires, where we see most of the cases and also the highest number of inhabitants. But we do believe that, as well as other countries, Argentina will flatten the curve. We need to be patient, and the reopening always brings along new peaks and an increase of cases. So it could have been an early reopening, could have been, but we do not have a clear definition or a clear limit between what it is right or wrong. This is a new virus. It is important to take this into account, but Argentina has been highly committed with implementing the necessary measures, from the president of the nation to the lower level officials. So I think that the society has participated. The minister also involved the specialized society. There has been a dialogue, and we believe that these measures will be effective. But as we all know, this is a virus that is completely unpredictable. We do not know all of the answers, but we trust that Argentina at some point will be able to flatten the curve, in particular in the metropolitan area of Buenos Aires and Greater Buenos Aires. Thank you very much. The next question is by Mike McDonald from Bloomberg News. He's in Central America, and he's asking if PAHO has studied the initiative of El Salvador that started about a month ago to provide immunity cards to those who recovered from the COVID-19. Is this something advisable, Mr. Barbosa, Dr. Barbosa? Thank you very much. The issue of the health passport was quite discussed at the beginning of the pandemic, but most of the countries abandoned this proposal for some reason. On the one hand, because of the reasons indicated by Dr. Espinal, we do not have any certainty as to the duration of the immunity of a person who had COVID-19. We do not have that information. Therefore, the person may receive that passport and believe that they are duly protected, and later on, after have a new infection, because the immunity may last only a couple of months. We do not know. For that reason, we do not recommend that. And also, there is a problem from the ethical point of view. In countries where we have informal and a large informal economic sector, if a person who has the health passport may have easier access to the labor market, that may be a stimulus for individuals to expose to an infection. So we do not recommend that passport. We think that it is not a measure that could help all the efforts being made by the countries to control transmission. Thank you. Thank you, Doctor. And Daniel Collins from TN23 Guatemala is saying that Guatemala, together with other countries in Latin America, will be opening their borders. What are the recommendations? And the population may be introducing some economic activities, but also forgetting about the second wave of transmission. Dr. Ugarte, yes, it is very important to consider that the economic reopening is extremely necessary. And to that end, we also need to weigh safety and security as well as life for people. As the doctor indicated, Marcos and Dr. Barbosa indicated, I would like to highlight that the public health measures, public health protection measures need to be active for several months in the future. And this is something that is a guarantee that we are aware of the rate of transmission of the virus. Second, that we allow for health services that have high occupancy to also have availability in case there is a number of patients that do need intensive care or hospitalization in a short period of time. And third, that we can activate the economy in a safer fashion. To that end, it is highly important, first, that if we have those measures, the economic activity may be reestablished. Second, once the economic activity is reopened, we need to be vigilant and think of all of the aspects that need to be implemented from the very beginning. Everyone who has symptoms compatible with COVID-19 need to be immediately isolated, as well as their contacts that need to be quarantined. They need to be tested. And as to the result of the test that may take a long time, they need to consider that these are COVID cases until we can prove that the contrary is true. This is the only way we could reopen the economy. This is for Central America, South America, the Caribbean, and many other regions where, after a very long time of having no cases, such as in Europe, after the reopening of the economy with an excess of trust, the number of cases increased significantly, and this is also what happened in connection with Canada and the US and Argentina, as we heard through the questions, where it is necessary to establish very active surveillance. If we know where the virus is, and we can reduce transmission, and also we can provide care to the patients and save their lives, we will be in a better situation to reopen the economy. Thank you. Thank you, Doctor. We are approaching the end of this press briefing, and we have several questions regarding the influenza season in the Southern Cone. And Michael Safi from The Guardian, who says,
Southern Cone have remained low compared to previous levels. Are there lessons for the Northern Hemisphere as it enters its own flu season while fighting the COVID-19 pandemic? Doctora Etienne?
So thank you for that question. It is true that compared to previous flu seasons, influenza occurrence in the Southern Cone has remained low and below seasonal trends, despite the fact that countries are seeing a high level of COVID-19 transmission. And that may be due to several factors, including the stringent public health measures that were implemented for COVID-19, the underlying population immunity for seasonal influenza viruses, as well as the efforts to ensure that that flu vaccination is carried out and kept at a high level. However, this does not necessarily mean that we can conclude that the Northern Hemisphere will experience similar trends. It is difficult to anticipate what might happen as we enter influenza season in the Northern Hemisphere, but there are several measures that we can and that we should put in place to prepare. And these lessons learned reflect actions that were embraced in the Southern Cone and likely helped lower the influenza transmission in the Southern Hemisphere. So it is vital that surveillance for influenza, which existed before the emergence of COVID-19, we must make sure that that continues. While the number of influenza samples processed in other regions of the world has declined or even disappeared completely, since the start of the COVID-19 pandemic, this number has actually increased in the Americas. So we are on high surveillance. It is also important that, particularly in areas with ongoing and emerging community transmission of COVID-19, that public health and social measures are implemented. This will prevent the spread of COVID-19 and will likely prevent spread of influenza and other respiratory viruses. So finally, it is also important that countries continue to maintain a high level of routine flu vaccine coverage. And that is particularly so for the high risk and the vulnerable populations, in order to prevent outbreaks of influenza and avoid further burdening the health systems during the influenza season. So I really can't stress enough that as the world is struggling to develop a COVID-19 vaccine, we do have an obligation to make the most of the vaccines that we already have and that we know are safe and effective. Really, there is no better way of doing so than getting an influenza shot this season. Thank you for being with us.
Muchas gracias, doctora Etienne. Muchas gracias.
Thank you very much, Dr. Etienne. Thank you all for participating in this session. We have reached the end of this press briefing today, and we will be briefly sending you the opening remarks by the director as well as the recording of this session, and you can also visit PAHO's website for further information. Thank you all for your participation, and we will see you next week on Wednesday at 11 a.m. Washington, D.C. time. Thank you very much. So long.